would like to ask you, what is the specificity of working with a bilingual and multilingual stuttering patient?
Okay, well, I could talk about this topic for hours, but I will do my best really to be brief and to give you a straightforward answer to your question. I will try to highlight what to consider in assessing and treating bilingual patients who stutter. So I'll talk about assessment and treatment. But first, let me just say briefly that at this point in time, we don't have much data about the manifestation of stuttering in bilinguals. We have some data that are available, but they are quite different. The findings are quite different. However, we know that stuttering typically occurs in all spoken languages when the patient is bilingual, but the manifestations can be different from one language to another. For example, a person who stutters can sometimes stutter more in his dominant language, because in your dominant or language or mother tongue, you're able to express easily, you're more spontaneous, you speak faster. So it might be a reason why there's tendency to have more disfluencies, for example. But we have also many studies that show that the disfluencies occur more in the non-dominant language. And this might be related to the fact that more cognitive resources are required, and the inhibition of the dominant language is required when you're speaking with your non-dominant language. So this would also lead to more disfluencies. Some other interesting studies also have shown that the type of disfluencies can be different between languages. So we can see, for example, more repetitions happening when speaking the dominant language, but more prolongations happening when we're speaking the less dominant language. This is just a brief overview. But as I said, I will focus on the assessment and the treatment. So I'll talk first about the assessment of children who are bilingual, who are coming to our clinics to potentially identify or diagnose stuttering. So given the specificities related to the linguistic profile of bilinguals and the variability related to stuttering, it is important to take into account some important elements when we are making the assessment, when we are assessing the fluency of bilingual children. The first important element is that we need to listen to parents, of course, and to take their concern into account. It shouldn't be overlooked during the speech therapy assessment, because we know that it is a reliable source calling for the need for further investigation. And the clinician must understand the child's linguistic environment. So when we have a child who's coming to our clinic and who is bilingual, we really need to inquire about the linguistic history, which is we need information about the age and context of exposure to the different languages that are spoken by the child, the linguistic function, which refers to the current frequency of exposure and use of different language, and the language proficiency, which refers, of course, to the child's overall ability in speaking and understanding a language. We really need to have very specific and detailed insight about these different components in order to lead to a reliable diagnosis. A third recommendation would be to collect speech samples in all spoken languages. So we can't look only at one language when a person or a child is bilingual. We need to collect speech samples in all spoken languages. And this, of course, will allow a more exhaustive assessment of the speech disfluencies, and we will be able to compare the manifestations from one language to another. Finally, I would say that one last but very important thing to consider when we are assessing bilingual children is that typically developing bilingual children seem to have frequent disfluencies in their speech if we are comparing them to monolinguals. This is based on very recent studies. And some of these disfluencies overlap with stuttering manifestations, such as the repetitions of monosyllabic words, syllables, and sounds mostly. So this might easily, maybe at some point, put them at risk of being wrongly diagnosed with stuttering. What we need to look for, it's a very important point, we need to seek other clinical features in favor of a reliable differential diagnosis, which are the presence of physical tension that is coming along with the disfluencies and an abnormal rhythm of the iterations. Usually when children are typically developing, there's no tension in their speech, and the iterations of the repetitions are quite relaxed and regular, but this is not the case in stuttering. So this is an important point to look at when we are diagnosing bilingual children, because of the frequency of disfluencies, sometimes coming with an accurate diagnosis might be challenging. Another very important component to look at is also assessing or examining the child's reactionary attitudes to disfluencies, and to look for a certain change in the general behavior, like if the child is becoming angry or isolated, or a change in his verbal behavior, like losing the communication appetite, for example, because we also know at this point that children who stutter do have negative reactive attitudes toward their speech, but this is not seen in, for example, bilingual children or children who do not stutter in general. And this also should be considered when establishing a differential diagnosis, especially in a bilingual context, as I said. With respect to adults who are bilingual, of course, overall the assessment does not really differ much from monolingual adults who stutter. So clinicians should include a detailed case history, of course, and consider language history and experience throughout the use of questionnaires, for example. So we also need to understand how the patient is using the languages and get more insight about that. And speech samples also should be collected in all spoken languages. Of course, we need to get insight also about the affective behavioral cognitive impacts of stuttering. This should also be examined as in monolinguals. So we need a holistic approach with consideration for bilingualism. And this will prepare the clinician to work with the patient on individually tailored therapy goals. Now, with regards to treatment of bilingual people who stutter, so I think, as far as I know, up till now, there are no specific guidelines or therapeutic approaches for the treatment of bilingual people who stutter. The available literature suggests some factors that should be considered while providing treatment in a bilingual context. In general, the most frequently seen or recurrent are the language used during therapy, so what language to use with the patient, and the generalization of progress from the treated language to the untreated one. As I said today, there's no sufficiently reliable research to consider that bilingualism is a risk factor, for example, to stuttering. So even though some studies suggested eliminating bilingual education in the case of stuttering, this currently should not be advised, because we know that bilingualism has so many advantages, and we really need sufficiently significant evidence to give parents of bilingual children such advices. And even in some cases, it is even harmful to limit the parents to using only one language. I'm referring, for example, to couples who are mixed couples, mixed marriages, everyone, the parents speaking different languages. So it is important to really keep in mind that bilingualism is really an advantage. And what should be recommended at this point in time, I think, is a flexible and pleasant practice of bilingualism, this seems to be the most appropriate advice to give to parents at this point, according to what we know at this point in time. With regards to which language to use and the generalization effect, so there's only a few studies, as far as I know, that had provided documentation on the treatment of bilingual children who stutter with regards to this generalization of treatment progress within languages. So there are some case studies that show that gains that are made in therapy in one language, the language that is treated, might generalize to a non-treated language. But in some other cases, although the studies showed that there were some gains that appeared from in the non-treated language, but the progress wasn't really big, let's say. So ideally, I think that providing treatment in both spoken languages, if it's possible, appears to be the best approach. But of course, as I said, if it's possible, it's not possible for all clinicians. And sometimes we have patients who can speak different languages than ours. So the treatment should be, I would say, a collaboration between the skills of the clinician and the linguistic knowledge of the child's family. And with adults who are bilingual and who stutter, the best practice also would be to provide bilingual therapy when it's possible. If it's not, again, the clinician should use the skill set in one language to support the patient in all spoken languages or the needed languages. For example, if we're working on some fluency enhancing techniques, the clinician can demonstrate in one language and ask the patient to practice in the other spoken languages. There's also a lack of research on bilingual adults who stutter generalizing treatment gains in one language to another, but some very preliminary findings exist, and they do indicate that we can have a generalization effect from one language to another. But of course, more research is needed to have more guidelines.
Okay, I think this issue will be very interesting to all speech language therapists who work with people who stutter. Also for those who have not yet had the opportunity to conduct therapy for a bilingual or multilingual person who stutters.